I'm pleased to introduce Ramdeep, Dosanjh, and Ricky Tsang. So Ramdeep is a upper year medical student upper year UBC student, currently completing a BSc combined major in science, specializing in life science, earth science, and chemistry. And Ricky is a third year medical student at the University of British Columbia. And together they'll be speaking on championing women's health, exploring silver linings in the pandemic. Welcome.
Great, thank you so much for the introduction. Just wanted to check, can you hear me okay? Excellent, so I think Rami has control. We'll just let her put the slides up, give her a moment. Okay, excellent. So thank you again, and good morning, good afternoon, I suppose. It's just past 12 on a Saturday. My name is Ricky, and I'll be presenting today with Rami on this particular study, championing women's health and exploring the silver linings of the pandemic. By means of housekeeping, I'll briefly present the agenda of this brief talk. We'll start with a line acknowledgement and then proceed to an introduction where we'll discuss the inspiration or catalyst behind the study, touching broadly on COVID-19 and women's health. We'll also discuss our primary research questions, a brief overview of our methods, and provide a summary of our progress to date. So with that, we'd like to acknowledge that we are today presenting from Vancouver, which is situated on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. And on top of that, we'd like to acknowledge the role of all Indigenous nations, actually, and peoples in the stewardship of the earth. So as I mentioned earlier, we are presenting on behalf of Dr. Farah Shroff. She is a global public health researcher. And on a personal note, one of my former tutors in the MD undergraduate program at UBC. Canadian, Dr. Shroff was born in Kenya and is extremely well-traveled and well-versed with personal, professional, and academic connections globally. She's also the founder and lead of Maternal Infant Health Canada, a research and public health collective which focuses on improving the health of communities globally with an emphasis on maternal mortality, women's health, and the environment. Of note, MIH Canada's focus has been on both the upstream and downstream effects, or needs rather, of Canadian and Indian women. Currently, Dr. Shroff is a Takemi Fellow in International Health at the Harvard Chan School of Public Health. She's also on this call, and she'll be a speaker tomorrow as well as part of this program. So officially, COVID-19 was declared a global pandemic by the WHO on March 11th, 2020, and remains classified as such. It goes without saying, of course, that the past 2-3 years have been rather different to the status quo that we've become used to. And it's, suffice it to say, it's been challenging for most, if not all, but we know that certain groups around the world have been disproportionately affected. In addition to the wave of research into COVID vaccines and pharmaceuticals, there was, of course, in parallel, a wave of research on COVID and COVID-related topics. Much of the research, but not all, I suppose, and by no means am I trying to paint it with a broad brushstroke, but most of it was negative in nature and focused on the detrimental and often devastating effects of COVID on women. Dr. Shroff's idea here was to approach the problem from a sort of a different lens and to try and find the silver linings that came about from the local, the regional, and the national responses to COVID from a public health, legislative, and community point of view. In fact, the working title when we were convening the group for the study was called the Silver Linings Study, so to speak. And I suppose it's always difficult to experience or witness tragic events with mortality, but I think if we are intentional and thoughtful about them and make every effort to learn from them, then some good can come of it. And an example of this is back in the 70s and 80s, there was a slew of aviation disasters in the United States and abroad, and through extensive investigation and research and the subsequent policy and legislative changes that came about, flying is thankfully much safer today. And what does that mean? So coming back to the study, of course, everything is rooted in the question, how are we going to make the world healthier, especially for women? And how can we emerge from COVID in a stronger position than previous? So one way to approach it is through exploring it through the lens of the social determinants of health, as well as a parallel exploration of public health and politics, which are, of course, intertwined. And part of Dr. Schroff's interests was also to explore some integrative systems of health promotions, which does come through in our focus group discussions, as we'll briefly touch on later. This little piece here was published in 2019, and this again illustrates that health, and by extension public health, is indeed politics writ large and small, and speaks to why this study is very much policy oriented in nature. What I talked about earlier, of course, was a broad overview. So when it came time to hone in on some more specific objectives, this is what we came up with. So broadly, the big research question is, how can changes engendered through COVID-19, particularly those engaging digital technology, be a catalyst for improving women's health? We also have a couple of sub-questions as well. So what are the big lessons that are being learned that are relevant to building a more equitable post-COVID-19 world, especially related to technological advances? What factors during previous pandemics, HIV, H1N1, Ebola, and the like, have enabled positive responses that embrace a commitment to better women's health? And how can these be harvested during COVID-19? And finally, what policies are required to build a more equitable post-COVID-19 world, especially in relation to technological advances? All of this, of course, with a greater goal in mind, which is to create a more equitable post-COVID-19 world. So just as a brief overview, the detrimental impacts of COVID-19 on women is very well documented, both in literature and in news feeds worldwide. Housing, a major social determinant of health, has been precarious for many, especially women, during the pandemic. Women have also been subject to increased workload from a domestic and occupational point of view. Domestically, they've had to take on more responsibilities, from homeschooling to cleaning, cooking, among others. And I think this was touched on in a previous presentation as well. For some women, especially those without the flexibility to work from home, they've been asked to take on more work, especially high-risk roles with potential for exposure to virus in the context of inadequate PPE. Not surprisingly, this, among many other things, has led to exhaustion and burnout. And in some areas during the peak of the pandemic, access to women's health was very much restricted or compromised due to scalebacks, backlogs from social distancing, or general fear of transmission being in a healthcare setting. Mental health is another area of compromise against the background of all of this. And I've read a number of media reports that mention something to the effect that COVID has the potential to set women's progress back decades. And in fact, a United States Conference on Trade and Development publication also mentions this very fact. And while it may seem I perhaps have cherry-picked some of these publications, there exists ample similar articles like this. And this just serves to illustrate the many impacts of COVID-19 on women's health and well-being. Unfortunately, of course, COVID-19 and its related policies, many of which are well-intentioned, designed to protect us from infection, have resulted in an increased incidence of violence against women around the world. Many women are, in fact, trapped with their abusers due to social distancing, working from home, and lockdowns. Shelters have also decreased in capacity or are at capacity as a result, and family and friends with decreased physical interactions have had less ability to intervene. Of course, this study focuses on the silver lining. So one of the silver linings that did come out of this, or one of the innovations, was that I believe in Europe, France in particular, developed a alert system where grocery stores or corner convenience stores would be the orchestrators of this, and women who are subject to abuse or experiencing abuse could go in and alert the clerk of their situation, which would trigger a cascade of procedures where law enforcement could get involved and potentially intervene. But again, this is a silver lining study, policy changes study, which brings us to the methodology part, I suppose. We adopted a mixed methods approach, as we believed it would better allow us to understand the complexities of COVID-19 experience on women, and to allow us to elucidate the rich subjective insights contained thereof. It was done in two parts. The first was a survey administered online via Qualtrics. The second was focus groups, which captured a subset of survey respondents and featured Dr. Schroff as the moderator, as well as a regional lead from each of the regions we sampled. And this study focused on women's health experts. So these included physicians, allied health professionals, public policy professionals, and policymakers. To give you an example of what was captured in the survey, and we really won't delve into the results today, this particular question here yielded some interesting insight and responses. And reading through the question, you might have an inkling of what those may be. All of this to say, of course, is to stay tuned for when the paper does come out. Question 5 here. This question here gets at public health policies and innovations that were implemented during COVID, and it attempts to have the respondent think about any potential solutions if none such exist. And, not to belabor the point, jumping over to question 7 here, going back to what we discussed at the start, we also try to understand rather the social determinants of health that our respondents identify as being crucial for women's health and well-being. It also serves to give us a baseline of how women around the world, again, this is global in scope, view the ingredients for a healthier society. And this question here in particular tries to get at having our respondents think about initiatives, both big and small, that may have improved women's health before and during COVID. Some have considerable overlap, while others have been scaled back, while some truly novel innovations, many of which were led by women, were brought to life during COVID, especially at the local level, which have resulted in the healthier communities. Again, going back to someone's quote, I think mentioning about, when women are healthy, families are healthy, their communities are in turn healthy. But again, not to belabor that too much, I will hand it over to Rami, who will talk about the focus groups in a bit more depth.
All right, thank you, Ricky. So from the focus groups, 65 of the health experts that were surveyed on topics relating to policy action and the current status of women's health during COVID-19 participated in focus groups. These focus groups were based in Egypt, Sudan, India, USA, Mexico, or Canada over Zoom. 27 health experts participated in the Egypt, Sudan focus group, 18 in Canada, 12 in USA, Mexico, and 8 in India. A pretest was also conducted in Mexico with global health experts. Focus group questions and a script were created to facilitate talks of policy recommendations for women during COVID-19. These focus groups also discussed mental health and silver linings during the pandemic. Open conversations with health experts provided us with policy ideas for the betterment of women's health. Now moving on to the analysis. So these focus groups were transcribed with Zoom's speech-to-text function, as well as being recorded. So each focus group's transcription was reviewed for errors by research assistants and clarity with the recordings, to make sure each transcription was accurate. Next, the focus groups were coded using NVivo software, which generated an iterative approach. By following a coding framework, major themes were extracted from the focus groups, thus applying a thematic analysis. So just to discuss the survey a bit, the survey data, we have prepared quantitative images of the answers. The qualitative data is being cleaned and will be analyzed using NVivo, as we've done with the focus group data. So some reflections from our focus groups. We found that at times it was challenging to engage groups on positive aspects, in other words, the silver linings. Many thought-provoking ideas from health experts came from the challenges faced during the pandemic, and we found it was hard to focus back on what was going well. Another difficulty from the focus groups was the amount of policy recommendations we were receiving. Very few had concrete policy recommendations. Lastly, we believe that we need more than just policies to provide lasting change for women's health. We also need action. So we came up with a set of themes from coding transcripts, and this is just a draft of set themes. So stay tuned for when the paper comes out, because that'll have the complete list of themes. Moving on to next steps. So we will be cross-checking survey data with focus group data. We've done a literature review of the themes and for an in-depth discussion of that in our paper. We've also have a diagram, or more so a visual abstract of major themes and policy recommendations. And this was created by a research assistant, Jaya Cayley, which is included in our paper as well. And we're also very pleased to announce that we've submitted our manuscript and we are very excited for you all to read it. MIHCan is also currently organizing a campaign called Break the Stigma to promote open conversations about mental health and well-being. For more information about this campaign, please contact Dr. Shroff. Now we'd all like to ask you a question. Which superpower would you like to have for improving women's health during this time and post-pandemic? Is it A, ensuring women are safe, B, creating gender equity, C, improving women's income, D, giving women more social power in families, the community, and workforce, E, reducing women's work at home, or F, something entirely different that you wish to elaborate on? And I believe Ricky will be including a link in the chat for you to participate in the poll.
So I have clicked on the link and I have sent mine in. So if you go into the chat box, you'll see under Ricky Tsang, there is a link there. So it's pretty easy. So Ramdeep, will you be giving us the answer to that, or is that for you guys' future use?
Oh, we'll be sharing answers.
Here, right now.
Right now, yes.
Okay, thanks. So while we wait for people to put their answers in, Ramdeep, just want to do a bit of a time check with you. How many more slides?
I believe we have 3 to 4 more slides. We're almost finished.
Okay, thanks. Yeah. Perfect. Thank you. Great presentation, great information.
Thank you. Yeah, okay, so I've gotten the okay from Ricky. So it's actually just what we expected from the results. They're relatively even. And that's actually interesting because all of these topics are interconnected and they go into improving women's health. So thank you for participating in the poll, everyone. To conclude this presentation, we at MIHCan believe that despite many challenges, by working together, we can create a better world for women where they can thrive. The COVID-19 pandemic has presented many prospects for change, also captured by global feminist recovery plans. The study of the silver linings of the pandemic illustrates that women's health may be improved despite their setbacks. So thank you for listening, everyone. If you'd like more information on the study that we've done, feel free to contact Dr. Shroff through email. And now we'd like to open up the floor for any questions.
Thank you both very much. As I just mentioned, it's a great topic, and you know, I always love when we take very challenging, complex issues and we apply an appreciative inquiry lens to it. So we flip it around and we look and say, what is the good in this, or what do we learn from this? So I think that that's an amazing piece of work that you're doing there. At CINS, we don't give you a whole lot of time to present because we want to hear from a lot of people. So one of the slides you went over really quickly in the themes of some of your qualitative work that you were doing. And I know that you're not quite ready to release everything out yet, but can you just tell us what is one of the themes that's coming up that's quite strong?
Dr. Schroff, would you like to address that question?
Sure, and I want to just thank Ricky and Rami for doing an amazing presentation. They really represented the study really well. Yeah, thank you both of you. It's been a delight to work with you on this project. One of the themes that came up was the importance of addressing mental well-being, and it was led really by our focus group in Egypt and Sudan, and then we saw that the data saturated from other countries as well. So basically the theme that rose up was to address mental well-being by creating more open conversations and more open dialogue for mental well-being. And because this was a policy study, Maternal and Infant Health Canada wanted to make this into our policy as a global public health collaborative. So we actually just led a 6-week campaign called Break the Stigma. And we did it in Canada. Everything was online, in Canada, India, Egypt, Latinx community, all the regions of our study. So that was a really, really big topic, trying to open up conversations about mental well-being, because stigma is one of the biggest barriers to improving mental well-being. So just making these conversations more normalized and more open. Certainly these are not just for women. That recommendation bears towards all people on the gender spectrum, those who identify as men, women, transgender, non-binary, and gender non-conforming people.
And another question is, because you're, it was like I guess maybe I'm going to use a term wrong here, but a funded policy document. If we go back to the discussion we had with the last presentation, is around that knowledge mobilization, getting knowledge into practice. What are your thoughts around the impacts that this research is going to be able to have on the decision making? That might be too big of a question.
I'm happy to address that if Ricky and Rami would like. Otherwise, yeah, please, one of you go ahead.
Dr. Schroff, go ahead.
So many, as I just said, we are a global public health collaborative. We are actually very proud to be affiliated with the Canada-India Network Society since our inception. Dr. Garg is a member of Canada, of Maternal and Infant Health Canada. And, and so we did take it upon ourselves to make these policies have some impact. And our Egyptian collaborator is also making some of our other policies in place with universities in Egypt and with the Egyptian Ministry of Health. Yeah, we really want at Maternal and Infant Health Canada to do research that actually makes a difference. We really see that gap, that research policy gap, as being big, and we want to close it. So we're actively engaged in that research policy space ourselves.
Perfect. Thank you so very much.